Shiwei, sexual health doctor at the Imperial College in London and a leading advocate for the intersection of how climate change impacts human health through research, education, policy, and advocacy. From founding healthcare students for climate action during their medical studies at the University of Leeds to researching the link between extreme heat and severe mental health at the London School of Hygiene and Tropical Medicine, their work strives to use innovative ways to communicate climate health. Whether speaking at festivals or global platforms, such as the Planetary Health Annual Summit, they are committed to empowering the next generation of climate health conscious professionals. Shui thinks out of the box and will share some of their creative work in bringing our attention to the heat harms of schizophrenics.
Thank you. Thank you so much, everyone, particularly the Climate Psychiatry Alliance, for having me tonight. Yeah, as Robin said, it's 1 a.m. in London, so bear in mind I'm not the most energetic, but very happy to share kind of some work that I've worked on over the past year through my public health thesis at the London School of Hygiene and Tropical Medicine. So just for context, I'm currently a sexual health doctor at Imperial College in London, and I'm very interested in looking at how we can look through research, teaching, and kind of innovative ways to communicate climate change and health. And I'll just go through the slides. Okay. So, how do we define severe mental illness for those of you who might not know? Within the National Health Service in London, in the UK, sorry, we defined it by three conditions of schizophrenia, bipolar, and psychosis. I know various kind of research have defined it differently, but that's the standard NHS definition. And the severe mental illness group is actually highlighted as one of the core priorities to reduce health inequalities within the UK. As we know, they have a kind of reduced life expectancy of up to 15 to 20 years less than the average population. So they're particularly vulnerable. For some background, I'm sure many of you might know, or if you don't know, in 2021, there was a big study by Lee and colleagues looking at how the British Columbia heat dome impacted schizophrenia mortality. And they found that people with schizophrenia were 3 times more likely to die during heat waves. Obviously, that trickled down a lot of kind of public health interventions to kind of make sure that that group is protected. And now we've kind of having to feel and learn more about it within the UK. We have some research that we've done recently as well showing the increased mortality within this group. And right now we're experiencing one of the hottest weathers in May we've ever experienced in the UK. So definitely Alex, when he was sharing lots of the mechanisms, I was definitely feeling it. So thanks for explaining that to me. Which I definitely share with my colleagues as well. And so the research kind of aims at looking at doing a literature review, a policy analysis. I completed some key informant interviews looking at perspectives of different informants, and as well as making sure that I'm making recommendations that is practical to the stakeholders within London, particularly. And in terms of the methods, so the literature review looked at adults with kind of acute effects of heat within high income country contexts. The policy analysis looked at published, publicly available policies within the UK setting addressing heat and severe mental illness. And key informant interviews looked at perceived heat and severe mental illness risk in this group of individuals on the left. As you can see, what their kind of barriers and facilitators to heat resilience planning is, as well as any strategies or interventions that they could recommend to us. Very, very excitingly, I've had the opportunity to do something creative with this research, which I really wanted to kind of encapsulate. And I'm going to share this short film. One sec. So special thanks to the Women's Environmental Network for providing me with funding for this. Um, So just shout please if you can't hear the audio, but I retested it just now, so hopefully it will. Mm, Does it not want to do it now? Sorry. Um, let's give it a few moments. Okay. Thank you so much. I hope you were able to see that clearly. Um, just basically like kind of encapsulating the whole of my research, looking at how heat really affects someone with schizophrenia through the hottest day of London. But yeah, so sorry. So just to kind of show you kind of the links that we found from s- the evidence and the key informant interviews that we looked at compiling how extreme heat affects severe mental illness. So as you can see, a lot of the psychosocial things like sleep disruption that was seen in the video, things like being kind of socially isolated, not having insight with not dressing appropriately during the hot weather, maybe having like substandard housing, a very warm room, for example, not having air conditioning, the financial barriers, things like that, can impact someone with schizophrenia or severe mental illness, and make them more vulnerable to extreme heat. And in terms, just to overview with the results, so we looked at 25 articles. As you can see on the table on the right, the odds of mortality in schizophrenics are really high in terms of heat-related illness as well, 38%. Interestingly, for bipolar and mood disorders, there were some studies that showed protective effect of heat during heat-related illness. And you can see things like antipsychotics also increase people's mortality during heat waves. And they also kind of had there were two qualitative studies that looked at how heat looked at were able to the heat actually triggered their physical effects and also their schizophrenic symptoms, as you can see. And there was lots of gaps in knowledge from people with schizophrenia in accessing information and concerns about things like social isolation, having stigma around kind of believing healthcare professionals because of the distrust that they've had over their experiences in the past, which I've tried to portray as well as much as I can in the video. In terms of the results for policy, there was actually no policies on how heat waves affects severe mental illness to protect this group in the UK, which is obviously concerning. And sorry, the key informant interviews. So in terms of organization wise, there is a kind of good breadth of lack of training. So people, doctors, clinicians, healthcare professionals, they don't know what to do during heat waves. So really important that we look at improving training across healthcare professionals, looking at how we can efficiently disseminate heat health action plans that actually exist within hospitals in the UK, but lots of clinicians don't know about it. Barriers including structural constraints like housing, funding, the usual, as well as communication gap. How are we going to reach every individual at home with struggling with severe mental illness? Can you rely on healthcare professionals to go out in the hot sun on the day itself? Not that's too difficult. So really trying to look at how we can bridge the communication gap within the community. Enablers include research, cross-sector collaboration, and lived experience advocacy. And just a couple more slides towards the end. So some really great examples from colleagues in New York. They have a Be a Buddy program where they have an at-risk register that people can volunteer themselves. And they also train up volunteers, match them with a buddy and those at risk. And they actually check in with them just before or during a heat event, providing that support and also promoting kind of social cohesion as well, which is kind of a win-win for their mental health. Also, British Columbia launched a free portable air conditioning program for those with severe mental illness and low income brackets. So really reducing that financial barrier there. And just to finish up with recommendations. So this is quite UK context, so excuse the jargon a lot here, but essentially really important that we include the severe mental illness group within policy. We need cross-sector collaboration, leveraging on community resilience, community groups, lived experience groups to really inform these policies. How can we work with them to create public health messaging that is strong, that will reach these groups? And things like stigma, making sure that any cool space, things like that is kind of tailored to the needs of those with severe mental illness. And with housing, making sure that we're screening and making sure we're risk assessing what their home environment is like and what they need. Research definitely is always a must and need to gather more in the academic world. And I think the really next steps, which London is trying to do, is to fund more pilot projects to build a good case for the kind of UK government to influence and include more kind of strategies to protect this group. So yeah, that's all of my talk. This is just a conference kind of abstract. I've kind of put everything together for my research. I really appreciate you listening and I'm happy to connect as well through my contacts here.